Yes, they're doing everything they can right now to make sure every animal that comes to the clinic stays as safe as possible. So they say what they've been doing is when the owner calls to make that appointment, they ask them a series of questions to know what's the safest way to move forward.
The phone interview is probably the most important part of our whole thing. We're going to talk to them about, how long has this been going on? Where have they been? How long have you had the dog? Are the other dogs coughing?
Vets across the metro are now on the lookout for any symptoms of the canine flu in their patients, making sure they do their best to minimize exposure of the infection.
We have actually a specialty bag that has stethoscope and everything that is exposed to, that can be exposed to infectious things, or we keep it separate from the rest of the hospital. And we'll go out to the car, again, work with the dog, usually in the back seat or on the owner's lap.
Matt McQuaid, the owner of Yukon Veterinary Hospital, says when a dog is exposed to the canine flu, they may develop symptoms like coughing and a runny nose. And the symptoms may be so mild, the owner may not know their dog is exposed.
Have they been in a shelter situation? Have they been to a dog park? They've been to a daycare, the kennel. So, all those questions to see if there's a history of it.
Some vets in the metro are not allowing dogs into their clinics at all if they previously visited a certain dog park or the shelter. But Dr. McQuaid says their clinic in Yukon is continuing to do what they can to treat every patient. And later tonight in the newscast, I got a deeper look into what vets in the shelter are currently dealing with the canine flu vaccine shortage.